Often questions have arose whether there is a link between benign prostate hyperplasia and hypertension. For ages, scientists have established the fact that there is a strong link between benign prostate hyperplasia and hypertension because both diseases tend to be prevalent more in men of advanced age from 40 years and above. So as a result, they tend to be also more prevalent because of the activity of the sympathetic nervous system, in the sense that both play a vital role as one ages, especially men, because women do not have benign prostate hyperplasia, in the sense that women do not have prostate. So benign prostate hyperplasia is more common in men. Sorry, it only occurs in men. Like I said, it doesn't occur in women. So there is a tendency that someone who is hypertensive will equally have a benign prostate hyperplasia and vice versa. So in that sense, diseases such as diabetes, high lipid cholesterol, and even a sedentary lifestyle, for example, someone who is not involved in exercising, someone who do not exercise, have that propensity of developing a benign prostate hyperplasia, because obesity plays a prominent role also in the development of the BPH. Now, what actually occurs in men that have benign prostate hyperplasia? Actually, as age advances in men, the prostate, this glands of the prostate becomes toughened. It tends to toughen up, and the prostate begins to grow, as in increase very much in growth, thereby obstructing urinary flow. So, and ensuring that after the normal glomerular filtration in the kidneys, for the kidneys to be able to eject the urine through the urethra to the outside, it will be very, very difficult, because the prostate, the growth of the prostate have eventually blocked the ducts and ensure that the passage of urine is almost impossible. So thereby eliciting pain, dysuria, that is painful urination, and in some cases hematuria, blood in the urine, because the urine will be forcing itself to be ejected through the urethra, so thereby making blood to get involved in the passing out of the urine. So there are a lot of things men with benign prostate hyperplasia can do, but we are going to expatiate that in our further lectures. Good afternoon, my dear friends. This is Dr Basil C Esemonu. Please follow me on the Madonna Writers Club. My group is my own group that I do administer on Facebook. Also follow me on LinkedIn, as well as also both on YouTube and WhatsApp. As time goes on, I'm going to be expatiating further issues concerning benign prostate hyperplasia as it applies to men, so that we'll be able to completely analyze this all-seeming disease and ensure that our men get relief from the many questions they inundate doctors with, the many questions that are in their minds. So many of them are wallowing in abject ignorance, not knowing exactly what benign prostate hyperplasia is all about. Most of them feels that it's a death sentence. So we are going to gradually analyze all this, and at the end of the day, you would have derived a real lot that if you have this disease, you'll be armed with enough information that can be able to help you to combat it to the core. Thank you, and remain blessed.